Hello?
Hello, Medical F1 on call here.
Oh, hi doctor, it's one of the nurses on DSHAM ward here. I'm quite worried about my patient. I've got a patient called John Richards. Can you come and see him, please?
Okay, could you tell me a bit more about the patient, please?
Okay. So he is a gentleman who was admitted to us yesterday. He's 64. So on my handover sheet it says that he came in with some shortness of breath, but he's currently waiting for some blood tests to come back. I'm just a bit worried about him really, because he's in quite a lot of pain. He doesn't look very well.
Okay, what's his news score doing at the moment? Have you done a recent set of ops?
Yeah, hold on, let me just check. So his news is 3, that's because he's on some oxygen, so that's 2. Yeah, so his sats are 97, he doesn't have a temperature, that's it really.
Right, so news of 3 and he's afebrile, right?
Yeah.
And he's in pain, isn't he? So
he is, yeah, he's in an awful lot of pain.
And have you given him any analgesia at all?
No, not yet. I think he's got some written up, hang on. Yeah, so he's got some paracetamol and some Oramorph written up.
Okay, well, what I suggest is he sounds quite stable, so give him some analgesia, see how he gets on. If the pain improves, that's great. If he doesn't, call me back, alright? So, okay, brilliant.
Can you not come and see him? I'm just a bit worried about him.
Well, look, I'm with a really sick patient at the moment, actually. Well, okay, look, I'll put the patient on my list, and we'll try and get around to him, okay? His news score alright, so I'm not really that worried.
Okay, so I'll give him some painkillers.
Yes, great.
Okay,
fine. Thank you very much.
Thank you, doctor. Hiya, can I bleep the F1 on call, please? Okay. Hello, DSHAM.
Hello, DSHAM. It's Will here, the Medical F1 on call here. I think you bleeped me.
Oh, hello, doctor. It's me again. Yeah, so my patient's still in quite a lot of pain. The painkillers haven't really done anything, to be honest. He says his chest is very painful, and he's now looking quite pale.
Right, the pain's in his chest?
Yes,
okay,
yeah.
Okay, so how does he describe the pain, sorry?
So he says it feels quite heavy and just very, very painful. I'm really worried about him now. He wasn't like this at all earlier. He's looking really pale. I think he's just getting worse.
Right, okay. Look, I think I need to come and see this patient. And what's his X number, sorry?
Oh, thank you. So it's XB70267.
Okay, brilliant. Yeah, look, I'll look at the ops and bloods and I'll be around very shortly, okay?
Okay, thank you.
Thanks.
Hi, is it Mr. Richards?
Yeah.
Yes, it is. Hiya.
Okay, thanks. Have you got the notes for me?
No, they should be in the drugs trolley outside, or maybe one of the HCAs.
Okay, could you go and grab those for me? Just I need to have a chat with the patient. Is that all right? Yeah, thank you. Cheers. Hi, Mr. Richards.
Hello.
My name's Will. I'm one of the doctors. I understand you're having a bit of pain. Is that right?
Yeah.
Okay, could you tell me a bit more about the pain? So, where is it? Worse on breathing? How long has it been going on for?
The centre of my chest. It's just there all the time.
Right, okay, just here all the time?
Yeah, all the time.
All right.
Heavy.
Right. Is it okay if I have a quick listen?
Yeah.
Oh, thanks very much. Okay. Let's just have a quick press on your calves if that's all right. Okay, Mr. Richards, well, listen, your chest sounds nice and clear.
Okay.
Your calves feel nice and soft to me, although your heart rate's running a bit fast. I think it's very important for me to go and have a look in the notes and have a look at your blood tests, all right? I know you're in a lot of pain, but I'll be back shortly. Is that all right?
Yeah.
Okay, thanks very much. Cheers.
Hi, is that MedReg?
Hi, yeah, it's the MedReg on call. Can I help you?
Oh, brilliant. Okay, hi, it's Will here, the Medical F1 on call. I've got a patient on DSHAM ward that I'm quite worried about. He's in loads of pain at the moment. To be honest, I'm worried that he's having a PE, really, because he's really short of breath. He's needing oxygen at the moment, but I'm not really sure what's going on. He just doesn't really look very well at all.
Okay, can you give me a bit more of his history then?
Oh, yeah, of course. So he's a 64-year-old gentleman who came in today with a bit of shortness of breath, several days duration. The pain was worse on exertion, and occasionally apparently was happening when he was just sat down doing nothing. He's a smoker in his background, and he's hypertensive as well. The initial ECG when he came in was completely normal, although troponin was a little bit high. And actually, do you know what? I'm not really sure if his pain's pleuritic or not, and he hasn't had a D-dimer done or anything. And he's now had chest pain for the last couple of hours, which really isn't improving, even with paracetamol and Oromorph. On examination, his calves are soft, not swollen, not tender, and his chest is nice and clear. So I'm not really 100% sure what's going on.
Okay, so what does his ECG look like now, and is he cardiovascularly stable? And can you tell me what his troponin actually was? What was the value?
Well, I mean, in terms of his ECG, so his initial ECG was nice and normal, so I haven't done another one.
Okay.
His heart rate's quite fast at about 110, and his BP's quite high as well, at like sort of 164 over 89. And his troponin was 68, and the result, the repeat for that is pending at the moment.
Okay, well, we really need a repeat ECG with that troponin. Could you get on and do that urgently and give me a call back?
Okay, sure, I will do, yeah.
Alright,
thanks.
Give me a shout when it's done.
Okay, thank you very much. Cheers. Bye.
Oh yeah, is that ECG done yet?
Yeah, here it is.
Oh great, thank you.
Make sure you
Cheers.
sign it, please.
Yeah, sure.
Hi, is that Medreg?
Yes, hi, it's Kate. Is that Will?
Hi, yeah, it's Will again on DSHAM ward. You asked me to do that repeat 12-lead ECG, and there are some changes on it now.
Okay, and what are they?
So it looks to me like there's ST depression in V3 and V4.
Right, so it looks like the patient's having an NSTEMI then, not a PE. Have you started ACS treatment on him?
No, I haven't. I called you first because I was worried.
Okay, so you need to give him ACS treatment as soon as possible. Look in the doctor's handbook if you're not sure, but it's aspirin, 300 milligrams, clopidogrel, 300 milligrams, and fonparinux, 2.5 milligrams stat. I had a look at his odds on VitalPack, and I think it would also be sensible to start a beta blocker. So if you could give him some bisoprolol, 2.5 milligrams stat as well. Is he on a cardiac monitor, and has he got some oxygen on? And if he's not, can you get him on both, please?
Okay, all right. So it's aspirin, clopidogrel, fondaparinux. He's already on the oxygen, and I'll get him on a cardiac monitor as well.
Brilliant.
Right.
And don't forget to give him that bisoprolol as well.
Oh yeah. Okay.
Okay. So I'm currently with a patient in resus at the moment. I'm not sure I'm going to be able to get away anytime soon. So if he gets any worse, if he deteriorates, then I would suggest you put out a met call. Okay.
All right. Okay. Yeah. Thank you very much.
Okay.
Cheers.
Talk to you later. Bye.
Bye.
Just gonna take your temperature.
Right, okay. Sorry, I didn't grab your name earlier. What?
It's Pam.
Pam. Oh, okay. Hi, Pam. Listen, I think this chap might be having an NSTEMI, okay? Just had a chat with the Medreg. So it's really important that we get urgently, please, some aspirin, some clopidogrel, 300 milligrams each, plus some fondaparinux, 2.5 milligrams. Could you also get some bisoprolol, 2.5 milligrams stat as well, please? And tell you what, let's get him on a rebreathe mask. Let's get a cardiac monitor, and let's get him some GTN as well, because I think that'll help his pain a little bit. Okay, yeah. And a repeat set of obs as well. All right.
Have you prescribed all the stuff you want me to give?
No, I'll do that now. Okay.
Just going to change your oxygen. It's just a different mask, okay. Here we go. Take some deep breaths.
Okay. You are
Okay,
prescribed,
thank
right?
you. So you want some aspirin, clopidogrel, and then fondaparinux,
Yep.
and some GTN. Was that it?
Yeah, and some bisoprolol, please.
And some bisoprolol.
Yeah, thank
Okay,
you.
fine. Yeah, thanks. I'll get that sorted.
Hi, is he feeling any better?
No, he's really not feeling any better. He's had all of those medications and things, but it's just not made him any better at all.
right,
Can you just
okay.
talk to him, Doctor? He's not really sure why we've given any of these medications or why he's had an injection.
Okay, yeah, sure. I'll talk to him. Thanks. Mr. Richards, hi. Hi, it's Will again, one of the doctors. But listen, so the heart tracing that we've seen, it looks like you may be having a bit of a heart attack. Okay. So that's why we've given you all the medications that you've been having, so the aspirin and things like that, to try and thin the blood a little bit and just to help your symptoms.
What did I do?
Unfortunately, it doesn't look like you're getting any better at the moment, but we are doing our very best for you.
Have you run my wife?
Well, I'm just going to speak to my senior, my medical registrar, and we'll get back to you with what the plan is, alright? But you're doing very well, it's just things aren't getting quite as better as we'd like at the moment, alright? I'm going to go and give him a call. Okay, thank you.
Would you like another ECG, Doctor?
Oh yeah, please, thanks. Yeah, that'd be great. Cheers. Hi, is that Medreg?
Yes, it's Kate, Medreg on call.
Oh,
How are you doing?
hi, it's Will here, the medical F1 on call. I'm down on Desham ward with that patient. I've given the ACS treatment. I gave the aspirin, clopidogrel, etc. I gave some bisoprolol, and I've given him some GTN as well. But he's still in a lot of pain, and he's not really getting any better.
Okay, well, what does his ECG look like now? Have you done another one?
Yeah, so the nurse is just doing the ECG now, so I haven't actually got it yet, but...
Here we go, Doctor.
Oh,
ECG.
fantastic. So she's actually just done the ECG, which shows some ST elevation in the inferior leads.
Oh, okay, so that's looking much worse then, isn't it? So it looks as if the patient's having an ST elevation myocardial infarction then. He sounds really unwell. Look, I'm still stuck in recess at the moment, but I will be on my way up to you. I think as he's sounding so unwell, why don't you put out a MET call, and then we'll get everybody at the bedside to work out what the best course of action is for this man. He's probably going to need to go for PCI, and that might involve transferring him across to the other site. So if you can get on, put the MET call out, I will be there as soon as I can.
Right, I'm really sorry. How do you actually put out a MET call?
Okay, right, well what you need to do is you need to dial 2222, that'll put you straight through to switchboard. They'll need to know where you are and that you'd like to put out a MET call. So do you think you can do that for me?
Okay, yeah,
Right?
I'll do that now, yeah.
Alright,
Thank you.
brilliant. I will see you very soon.
Okay, thanks, bye.